If you've been wondering whether HealthShare might be a good fit for you, this video will help you figure that out. Because while health shares aren't for everyone, for the right people, they can be a simple and affordable alternative to traditional insurance. So today I'm going to walk you through who should and who should not join a health share. By the end, you'll have a clear answer about whether this is the right direction for you and your family. So just a quick recap, a health share is not insurance. It's a nonprofit community of people who agree to help one another with large and unexpected medical expenses. Each member contributes a set amount every month, and those funds are used to help pay for other members' eligible medical needs. It's pretty simple, it's transparent, and more affordable way to handle healthcare, especially if you rarely use your insurance, but still want protection for the big things. So who should join a health share? It really comes down to three things: your health, your age, and your willingness to take an active role in your healthcare. First, health shares are a great fit for people who are generally healthy. That doesn't mean you never get sick or that you're perfectly in shape. It just means that you don't have any major ongoing medical conditions that require constant or expensive care. So maybe you see your doctor once or twice a year or take a basic prescription, but that's completely fine. Health shares are built for those big, unexpected medical needs. Second, they're for people under 65 years old. Once you reach the Medicare age, you are no longer able to become or remain a member. And third, health shares are for people who are tired of paying outrageous amounts of health insurance and are ready to do things a little differently. With a health share, you do take a more active role in the process. You're the one who asks for a self-pay or cash discount, get an itemized bill, and submit it to your health share for sharing or reimbursement. It's simple once you get used to it, and for most people, that small bit of involvement is well worth it when you realize how much you can save each month. So if that sounds like you, healthy, under 65, and ready for a simpler, more affordable way to handle healthcare, a health share could be the perfect fit. Now let's talk about who might not be a good fit. First, if you're 65 or older, you won't be able to rely on a health share as your primary option. Now, a few do offer supplemental programs for people who are already on Medicare, but those are meant to work alongside Medicare, not replace it. Second, if you have major pre-existing conditions that require frequent or ongoing care, like dialysis, cancer treatments, or other long-term medical needs, a health share isn't the right fit. That's because health shares are built to help with unexpected medical events that occur after you are already a member. So if you join a health share and a few years later develop cancer, the health share will be able to take care of that for you because it wasn't a pre-existing condition. This is why it's so important to join when you are healthy, not when you just received a major diagnosis. And finally, if you want the convenience of traditional insurance, meaning you prefer to just hand over a card and let the hospital and insurance company handle everything, then a health share probably isn't for you. With a health share, you take a more active role. You ask for the self-pay or cash discount, you request an itemized bill, and you submit it to your health share. It's pretty simple once you've done it a few times, and the savings are often well worth that little bit of extra effort. So let's review who is a good fit for a health share and see if this sounds like you. So are you under 65 years old? Are you and your family members healthy? Are you willing to try an alternative to health insurance? Health shares are made for people who are ready to take control of their health care, who like knowing where their money's going, and who want to be part of something that actually helps people. If you've ever felt frustrated by rising premiums, network restrictions, denials, appeals, or surprise bills, now you know that there is another way to pay for your health care. Now, the next step is figuring out which one is actually worth joining, because there are a lot of health shares out there and they are not all the same. So in my next video, I'm going to share which health share I recommend and why.